Good afternoon, everyone. This is Pam Johnson. We're on the floor of Collaboration 2014, and I was fortunate enough to be able to ask Robert Kreyer and Dr. Garcia if they'd come and sit and talk about the presentation they just completed. So, welcome to both of you. And I thought one of the most compelling aspects of your presentation were some of the statistics you gave about the need for removable prosthetics in the future, and really how this is going to impact the dental profession in general, and the dental technician and dentist team in particular. So could you just kind of give us some background on what some of the statistics that you were quoting in your presentation? Thank you.
Thanks, and we've enjoyed actually working together doing this. I will tell you that there's probably more need than we've ever realized before with the Affordable Care Act, and the most quoted article is by Dr. Chet Douglas, and he did this study in 2002 predicting an increased need to approximately 35 million people needing some sort of removable prosthesis by the year 2020. But he didn't factor in, and he has said personally that he has underestimated the need. With the Affordable Care Act coming on, that's bringing in probably 8 million more patients who will have some means to seek some type of treatment. So I will tell you, with the technology developments and working in tandem with a great laboratory technician, a dentist is going to have to reinvigorate and revitalize that area of dentistry to really enjoy it and provide the highest quality for our patients needing a type of removable prosthesis, especially complete dentures.
Absolutely. Another factors that was didn't consider was immigration as longevity. The patients are living a lot longer, have a need, and we're doing cases on patients that are in the 80s and 90s. Things we wouldn't have, and implants wouldn't have dreamt of doing 10 years ago. It's changing dramatically. It's interesting the demand for complete prosthetics, in which complete denture is still a viable treatment option, is increasing dramatically. But then we have a decrease in the number of dental technicians, especially experienced dental technicians in this marketplace. So a fewer number of technicians, then entering in, the digital aspect of removable prosthodontics, trying to, help with that demand for technicians. So we're seeing, digital dentures, digital prosthetics, coming in, being a viable manufacturing, alternative for laboratories and dentists. But complete dentures is viable. The demand is increasing dramatically for complete prosthetics and even implant prosthetics. Only maybe 10%, 12% of the implants have been placed for the population. So that is huge in the future. But complete dentures is still, you're going to see, like Dr. Garcia said, with the Affordable Care Act, a huge demand. I think we did 2.8 million dentures in the United States last year for the laboratories. This is, in the coming years, is growing to over a $4 billion market, and huge demand. So looking at complete dentures is still a viable option.
Especially for the dentist in practice, this is a great practice builder as well. You don't necessarily have to prescribe implants for everyone. Start out simple and make sure you're providing the best quality of care, because you can always retrofit those. But a lot of the technological advances still have not translated to the intraoral use of many of the technologies. But that's why you need to pair up with a good technician to help you understand what technologies can support your care. It still comes down to the dentist making good impressions, understanding the patient's need. And so without that, it's just a refresh on the basic procedures you're doing, on how you're making your jaw relation records. And then the quality I provide a good technician, they're going to help interpret what best technology can help me enhance a better quality care for my patient.
And there's always going to be a market for a high-end personalized denture that only a dental laboratory technician can make by hand. Understand the patient's aesthetic expectations and do this with special contouring and colors in the acrylic and teeth, and which will not really truly be replaced by a digital, so to speak, denture. So, there'll always be that need, but there's also this need for a higher level of education with technicians and better communication and collaboration on the clinical and technical side.
And I have to say, as a prosthodontist, I do want to work with a technician. I don't want somebody who has no technical background or training as a certified dental technician. I want somebody who has the knowledge of what I do and what the intraoral condition is. And it's that communication that's going to help translate the technology to give some better care for patients.
Well, thank you both. It's a great presentation, and have a good day.
Well, thank you very much.
Thank you. Thanks.